I can.
All right.
Thank you.
Bye now.
Hey, there has been a renewed push to reduce the stigma when it comes to mental health, and that, of course, includes your kids ahead of the new school year.
As a longtime nonprofit, Albertina Kerr has been working hard to help young people overcome mental challenges. And joining us live now to tell us more about their efforts is Derek Perry, Chief Program Officer with Albertina Kerr. Good morning, Derek.
Morning.
Thanks for being here. So tell us about Albertina Kerr's history of helping Oregonians and as well as just the history of the program itself.
Oh, yeah. Kerr has served the Oregon community for 114 years, providing services for children and adults with intellectual developmental disabilities. We also call that IDD, and several other mental health challenges and social barriers. Some of the services that we offer include serving over 50% of the youth who reside in IDD congregate care settings in Oregon, leading the creation of employment and community living opportunities for adults with IDD, operating the only standalone subacute children's crisis psychiatric facility in the state, providing leadership and statewide policy discussions related to disability and mental health care, as well as training and innovation of best practices and programs for children with dual diagnoses. That's just a snippet of some of that history.
Yeah, you do a lot.
Yeah,
basically.
no doubt about it.
Yes. You know, mental health has really been at the forefront of a lot of people's minds with the pandemic. I mean, it's really had a big impact. As children head back to school, what can families do to, check in on their child's mental well-being?
Well, I'll tell you, parents and guardians play a very instrumental role and can help fill that gap for kids and teens who may be struggling. Just sitting down and talking with kids about what's going well and what's hard about the pandemic can make a huge difference. Practicing active listening, which includes validating and affirming feelings, it's that silence, right, that can fuel harmful thoughts and acts, whereas open and honest communication between kids and parents, teachers, caregivers, those conversations are the ones that bring light on some of those more darker thoughts. Some kids may not have access to their core group of friends or their usual way of coping, so we ask that parents work with them to identify creative new supports, such as COVID-safe ways to recharge, like socially distanced walks outside. Online yoga is becoming popular, meditation, exercise classes, or videos even. And just planning for fun activities to keep a family connected, such as regular movie nights, game nights, cooking. That can be challenging and fun at the same time, but the point is to listen, be reflective, and keep an open mind.
I mean, all of those are great ideas. I mean, when you look at the past year and how it's impacted children's mental well-being, how have you guys had to adjust over the past year and some change to provide your services?
I tell you, families are indeed struggling. That familiar landscape of the day-to-day activities has somewhat evaporated as the coronavirus pandemic persists. And for many children and teens, this new normal of social disruption and fear of losing a loved one is fueling the crisis of its own. It's been a tough year for our kids. The loss of social opportunity, being isolated in one's home, experiencing the unknowns of COVID, the loss of housing and food instability if one or both parents have lost work, and these regular updates, right, on the pandemic, focused on the human pain and death. We have certainly noticed an uptick in our children's mental health population. They're more depressed, they're anxious, they're hopeless. There's uncertainty about returning to school and other social type of situations. And it's also taken a toll in increases in diagnosable mental health conditions, drug and alcohol use, suicide, or self-harming thoughts. All of those behaviors and thoughts have increased in both frequency and intensity.
And this all comes when there's a nationwide shortage of people trained in mental health intervention. So how is Albertina Kerr working to solve that in our area?
Well, we have some wonderful child and family therapists. They're awesome, and they play an integral role as a member of the care team. And that care team is individualized for each kid as they validate their experiences, as they form healthy relationships with them, and offer skills to help manage some of the day-to-day stressors that they may experience. These child and family therapists, they bring the whole family unit together to identify difficulties in that family system and assist everyone in developing communication, social, problem solving, and self-management skills. Our child and family therapists, they really have to be the experts at sizing up what's going on in a family, creating a safe place to articulate it, and working on a variety of skills to enhance and sustain and improve quality of life.
Well, Derek Perry, thank you so much for joining us this morning with Albertina Kerr. I mean, all very, very important conversations to have between parents and kids, so very, very much appreciated.
Absolutely.
All right, to donate to their organization so they can continue that important work, we have a link on coin.com.
Yeah, all right. It is 7:43 right now. And up next on AM Extra, school supply prices are up, so it is time to save money on clothes.
So find out why parents should try shopping at consignment shops ahead of the school year. We'll be right back.